Lymphoma is a general term for any cancer that comes from a lymphocyte. A lymphocyte is a white blood cell in our body that fights infections. We all have two types of lymphocytes, B lymphocytes and T lymphocytes, each of which have slightly different roles in our immune system. And when either one of those goes awry, it leads to a lymphoma. Now, there are many different types of lymphoma. Depending on which type of genetic abnormality caused that cell to go awry, it leads to any one of the very different types of either Hodgkin or non-Hodgkin lymphoma. Mantle cell lymphoma is an uncommon type of non-Hodgkin lymphoma. It represents only about 6% of the 70,000 new cases of non-Hodgkin lymphoma diagnosed every year in the United States, making for a roughly annual incidence of about 4,000 new cases a year. So this is not a common disease. It occurs most commonly in men, more commonly than women, about 75% of the time, so about a quarter of patients are women, so certainly it does occur. With a median age in sort of older adulthood in the 60s to 70s, though it can occur really in any adult. As far as the type of lymphoma goes, it's really defined pathologically by a single genetic defect, which is a defect of the gene cyclin D1. Cyclin D1 is a gene that causes cells to continue to grow. And when the cyclin D1 gene is perturbed and sort of automatically left in the on position, that's when mantle cell lymphoma occurs. We diagnose mantle cell lymphoma, as with other lymphomas, on a biopsy. And it's very important when we biopsy to look for lymphoma that we get a large amount of tissue to study under the microscope. And so that means our preference is always to take out an entire lymph node that might be involved by the lymphoma. And that gives us plenty of cells to look at under the microscope and to stain and to do various testing. Once we have that tissue, the diagnosis is made by looking at a few different things. One is looking at the size and shapes of the cells under the microscope. So first we see lymphocytes, so we know that it looks like a lymphoma. Then we look at these cells and look at whether they appear larger than a normal lymphocyte, smaller than a normal lymphocyte, the size of a normal lymphocyte. And that can tell us a lot. We look at the features within that cell themselves. Some of these will look more slow-growing or indolent. Some will look larger and more aggressive. But oftentimes, just looking at how the general appearance is, the so-called morphology, is still not sufficient to make the diagnosis of lymphoma, or rather mantle cell lymphoma. Stains can help tell us whether it is one type or the other based on characteristic patterns of proteins on the surface of different lymphomas. So with the diagnosis of mantle cell lymphoma, or any lymphoma, to be sure, patients are going to be anxious and nervous. It's frightening to get a new cancer diagnosis. I think there are some important things that patients should do at the time of diagnosis. One is take a deep breath. Lymphomas are highly treatable diseases. There are numerous treatment options available, and we've made great progress in improving the life expectancy of patients with mantle cell lymphoma and in enhancing the quality of life in patients with mantle cell lymphoma. So I think it's important not to panic and to recognize that there are terrific options available to help patients live long, healthy lives with mantle cell lymphoma. Mantle cell lymphoma is not a common type of cancer, and so at the diagnosis of mantle cell lymphoma, I'd always recommend, in addition to seeing one's own local oncologist, to also see a lymphoma specialist, because mantle cell lymphoma is not a disease that is sufficiently common that it might be seen with a degree of frequency in a general oncology practice. And while general community oncologists are excellent oncologists and terrific at providing cancer care, there is such a rapid rate of progress in all lymphomas, but particularly in mantle cell lymphoma, that I think it's vital to at least get a second opinion from somebody who just takes care of lymphomas and therefore has their finger on the pulse of the latest treatment advances, since the field is moving forward very quickly. And the other thing that's important, I think, at diagnosis is in consultation with that oncologist, is to actually confirm that the diagnosis has been made and confirmed correctly, because we do see, because of the complexities in the diagnosis of mantle cell lymphoma, that occasionally cases might be misdiagnosed as another type of lymphoma or another disease. I think at the time of diagnosis of any cancer, particularly mantle cell lymphoma, because patients can be bewildered, it's frightening, And when you go on the internet, you'll find, and you Google mantle cell lymphoma, you will find a billion different hits and resources at your fingertips. And one of the most confusing things for patients is, where do you look for the most accurate information? There's a lot written out there. Some of it is not carefully reviewed by experts. Some of it might be outdated because the field moves forward so quickly. And so one of the biggest questions I get is, where do I look for good information? And what I say is, go to Lymphoma Research Foundation website. There's a terrific collection of resources online. There are publications, and the Lymphoma Research Foundation also has a number of educational resources that patients can actually go and meet with experts in the field and learn about different lymphomas, including mantle cell lymphoma, and interface directly one-on-one with people who take care of this disease every day.
When I was diagnosed with mantle cell lymphoma, it was very difficult to find information on mantle cell. I really did not know where to go for information, and I relied very heavily on my doctors to make the informed decisions for me. The new Lymphoma Research Foundation's mobile app can actually tailor information specifically for mantle cell patients, and it is really fantastic and easy to use. Lymphoma Research Foundation has helped me cope with living with lymphoma. There's always in the back of your mind the possibility that this is going to come back, and it's educated me so that I have the resources to help me be updated.